Goeienaand, good evening, Moweni. Dit is regtig vir my 'n groot voorreg om vanaand saam met u almal as alumni van ons fakulteit saam te kyk. As I look over this wonderful audience, I see some unfamiliar faces, and I have met some of you now, and I hope to get to know you a little bit better later. But I also see some people that are extremely well known to me, former classmates, former students, some current students, and some current colleagues. I'm really honored that you have made an effort to be here tonight, and I know how busy you are, so it's very special to me that you've taken the time out to come here. I have no intention to spoil your evening with a long, dry speech this evening. I know you much rather want to chat with your friends and classmates, but I see this evening as an opportunity, first of all, to introduce myself, to get to know you a little bit better, and to briefly share with you my vision for the future of the faculty as we reflect upon where we have come from and where we hope to go in the future. But before I proceed, I must take time to introduce some of my bodyguards that have accompanied me this evening. You know, deans are bodyguards. Firstly, I'd like to introduce Evan McTon. Where's Evan? There's Evan. Evan is at the back there. Evan is Director, Management Services at the faculty and a key member of my management team. It's really an honor to have you here, Evan. We also have Dr. Ronald Retief, who is Assistant Registrar at Tygerberg Campus. There she is. We have Tanya Rudowski, who is the Head of Research Capacity Development and Funding Opportunities. Where's there she is. And then, of course, we have Mandy Barnard, our Marketing Coordinator, and Thalia Cronier, our Consultant in Marketing and Communication. Really good to have you, and thank you for all the effort that you put into organizing this event. Thalia has come all the way from the UAE to be here, so Thalia, thank you. I'd like to perhaps start by focusing on you as the alumni. Most of us look back upon our university years with a great deal of fondness and nostalgia. Some of us have no memories at all of the university years, but still look back with fondness and nostalgia. And this is partly because it was a time when we were young and relatively carefree. By that I mean that our hair had not yet deserted us, and highlights were not yet an essential part of our monthly budget. But we look back with fondness also because those years had a profound impact on determining the path of our lives and nudged us into adulthood and the various responsibilities that accompany it. These were the years that when we made the decision to choose a clinical career and spend our lives in the service of others, or to follow a path of discovery in the health sciences. Many of us made lifelong friends and met our future partners at university. And as a result of those years, many will send our children to the University of Stellenbosch. At least I hope so. Alumni constitute a university's largest and most important constituency. They are the guardians of the heritage of the institution and will remain so long after the current academics, the administrative staff, and even the buildings are gone. Importantly, alumni can play a vital, and often do play a vital role in the health and well-being of an educational institution. A strong relationship with Alumni ensures that the university is aware of the changing needs of the real world, and they help the institution remain relevant. Experience in many different countries shows that the success of great universities depends critically on achieving a high rate of participation of its alumni. And such participation presupposes the existence of a good relationship between the two. Unfortunately, at Stellenbosch, our engagement with alumni has not always been optimal. We have tried to keep you informed of developments through publications such as Tegeland and Martiland, and have provided opportunities for ongoing professional development through the activities of Stelmed, for example. But we have not been good at helping you, our alumni, stay in touch with us or each other, and have not created sufficient opportunities for you to express your opinions or to contribute in practical ways to the life and work of the university. I am, however, very happy to announce this situation is about to change. Through the involvement of the newly established Alumni Relations Office and its vibrant director, who you've met, Bev Witten, as well as the postgraduate and international office, we aim to significantly improve our efforts to strengthen our relationship with you. So watch this space. Allow me now briefly to share with you some thoughts regarding my vision for the faculty as I embark on my term of office as Dean. I do not intend to provide loads of mind-numbing detail, but rather to leave you with a sense of the key areas of development I plan to emphasize during my tenure. Eerstens wil ek erkenning gee aan die leiers van die verlede vir hul uitstekende werk by ons fakulteit. John Salisbury, die 12de eeuse theoloog, het gesê, "We are like dwarfs sitting on the shoulders of giants. We see more, and things are more distant, and things that are more distant than they did, not because our sight is superior, or because we are taller than they, but because they raise us up, and by their great stature add to ours." As die 7de dekaan van die fakulteit Gesondheid Wetenskap, is ek my dank verskuldig aan my voorgangers, Professors Francie van Zyl, Andries Brink, Bok Wasserman, Faiki de Toy, Jan Lochner en laastens Wynand van der Merwe, wat onvermoeid oor die afgelope 55 jaar 'n stewige grondslag van uitmuntendheid by die fakulteit gevestig het. Ek vind myself aan die stuur in 'n ander tyd in die geskiedenis van hierdie land. Die uitdagings wat ons vandag in die gesig staar, is in baie opsigte anders as die van my voorgangers, maar tog in sommige gevalle soortgelyk. Ek is dus deeglik bewus daarvan dat ek uit vorige leierskap nog baie meer kan leer en dat ek bevoordeel is om op hul skouers te staan. Vision in the organizational sense has been defined as a picture of a desired future state that is sufficiently appealing and compelling to drive change forward. My vision can best be described in relation to 3 aspects of faculty life: the institutional culture, our contribution to society, and lastly, the nature of our interaction with our external environment. I'll start with institutional culture. It is now well recognized that an institution's culture driven by its underlying values, contributes strongly to its competitive advantage. And by that I mean its ability to attract and retain talented people, its ability to build and sustain excellence, and its overall resilience. For the sake of brevity, I will touch on two aspects of institutional culture that will be at the forefront of my personal leadership agenda. The first is people-centeredness. I envisage a faculty that enjoys an internal environment in which people are constantly inspired to achieve their full potential. I plan to do everything in my power to build an environment that is inclusive, where a multicultural and a multilingual community of students and staff feel supported, respected, affirmed, acknowledged, and valued. A great American football coach, Peter Carroll, once said, "It's important for a coach or leader to reach every team member individually at a gut level and give them a sense of their role, their contribution, their value, their personal value in the overall team pursuit. I want each coach and player to feel the inherent goodness in them and find a way to express their goodness and greatness on behalf of the team for the benefit of all." As Dean, this is precisely how I see my role, and it's a great privilege. And it is a role that I would also like to encourage in every other leader within the faculty. The second aspect of the institutional culture I believe should receive attention is the pursuit of innovation and adaptiveness. Underlying assumptions are challenged and new options are explored and tested. As part of that process, two questions would become a constant refrain. Why are we doing this? And why are we doing it this way? It's not good enough to do something just because we can, or because this is the way it's always been done. We constantly need to seek new ways of doing things and better ways of doing it. Now, innovation and adaptiveness can be spurred by many things. But one of those is interaction with the world around us. I think you will agree that as an institution, we have not always been as outwardly focused as we could have been. There is therefore a need for a mind shift in this regard. Few problems today are completely local, and there is much to be gained by collaboration with colleagues in other institutions, locally, regionally, and internationally. We must ensure that our processes of learning and discovery are truly international if we are to remain competitive. While this has already begun to happen, the trend is not yet seen across all the disciplines uniformly, so we have some work to do in this regard. But in those areas where we have become a global player, the benefits are immediately clear, as evidenced, for example, by the massive increases in the quantum of international grants and the significant increase in publications in international journals seen at the faculty in recent years. Now, what can we say about the faculty's contribution to society as a whole? I think you will agree that the goals of a university, and therefore the faculty, are to equip people with knowledge, skills, and attitudes that will enrich their lives and enable them to contribute to the well-being and the development of society. And we do this through education, through research, and also through community engagement. As a faculty, we have to be cognizant at all times of the realities of South Africa and the African continent, where the majority of the population live under conditions of poverty. I use the word poverty in its broadest sense to include poverty of income, poverty of access to health and social services, and poverty of opportunity. In each of these areas, we can and are making a difference. Access to education and the development of skills is the single most important factor that will determine the path of our lives, and ultimately the single greatest source of hope for the African continent. Our faculty will therefore continue to strive to provide a ladder of opportunity to as many able students to obtain a health sciences education, with a special focus on outreach to students from rural and other disadvantaged backgrounds. In his inaugural address in 2007, our rector indicated that he wanted Stellenbosch University to become significantly different and significantly better. He further said, this will be seen to have happened when the farmer's son and the farm worker's daughter have an equal opportunity to study at Stellenbosch University. I think this is a goal worth striving for. But of course, greater access would need to be accompanied by support measures to ensure success. In my role as Dean, I am intent on working to ensure that funding for health sciences is sufficient to provide the services, the technology, and the staff development required to advance the mission of the faculty. I'm very excited about the faculty's Center for Health Sciences Education. I see it as a future world leader in the scholarship of teaching and learning in the health sciences. Many of you know about the Ukwanda Rural Clinical School, funded in part by the university's HOPE project. This is another exciting initiative aimed at developing new models of rural community-based training in the Western Cape, and also aimed at improving the recruitment and retention of health professionals in rural areas. I must now turn to research. As you know anything about me, research has always been something that's very close to my heart. And so this is perhaps the easiest bit for me. Under my leadership, research will continue to be valued for its role in the advancement of scientific knowledge, the enhancement of teaching, improvement of health and healthcare, and the promotion of economic and social development. I will continue to promote and sustain a strong research culture, encouraging research productivity and visibility in both clinical and preclinical sciences. Some of my specific goals will be to attract and to recruit top-class researchers, to retain and to develop promising postgraduate students and researchers, and to develop the research infrastructure. I'm committed to the objective of doubling the number of PhDs produced by the faculty within the next 5 years, from the current level of about 15 per year. In addition, I will continue to actively monitor the external environment to ensure that research is aligned with the health needs of the population, and that research opportunities in the form of large-scale funding and research partnerships are identified early. Through my involvement with the Academy of Science of South Africa, I will be a strong advocate for the advancement of clinical research in South Africa as a whole, in particular through the creation of a national clinical scholars program, the awarding of clinical research chairs, and the establishment of national funding, a national funding and coordination scheme for clinical research. And I'm very glad to see Dr. Terina Tron. Where is she? There she is, Senior Director of Research in the University. I think her presence here makes a good statement that she supports this agenda too. Thank you for coming through. Over the past few years, several initiatives have been started at our faculty aimed at strengthening clinical research. Building on these activities, the next logical step would be to establish a center of excellence in clinical research, offering, amongst other things, on-site methodological training in epidemiology, biostatistics, data management, grant writing, and publishing to researchers across the faculty. I believe the notion of clinical research should also be expanded to include much greater collaboration with our basic science colleagues, to develop an area sometimes known as translational research, in which people at the bench work very closely with clinical researchers in the discovery of new treatments, new drugs, and other interventions. This so-called bench-to-bedside and back-to-the-bench research would necessitate an expansion of current laboratory infrastructure and expertise, an upgrading of the existing animal research unit into a modern state-of-the-art facility. Finally, in terms of research, I believe that capacity in health systems research would be important, as would be a promotion of evidence-based healthcare and population-based research into the prevention of chronic non-communicable diseases. And that would receive my solid support. Finally, I'd like to share a few thoughts with you on how I see the nature of the faculty's future interaction with the environment outside. A university's interaction with the public, the alumni, the government, the business arena, professional bodies, and other academic institutions can have a powerful influence on its ability to carry out the business of teaching, of research, and of service. Finally, colleagues, let me say I have no illusions about my current task being, let's say, a Sunday school picnic. Depending on how one measures size matters, the Faculty of Health Sciences is either the second largest or the largest faculty at the university. At around 4,000 students, it is second only to the Faculty of Management and Economic Sciences, but with a staff of well over 2,000 on our campus and the involvement of multiple funders and employers, it is by far the largest and most complex faculty in the university. Needless to say, with that challenge, I will need, and I hope I can depend on, your support. Thank you for coming tonight, and thank you for listening.